Hello everyone, this is Dr. Mawada, and in this video we will learn when to start statin therapy. I will go through this clinical case, and at the end we will see if this patient needs a statin therapy or not. So let's go through this. A 50-year-old man come to discuss heart disease prevention. What is his history? Let's see. He has abnormal liver function test. He underwent a surgery for his knee. He drinks alcohol and he smokes half a packet for the past 20 years. So let's calculate how much he smokes. You should multiply how many packs he smokes for a day by the number of years. His father had a myocardial infarction at the age of 62. This is not significant. A positive family history should include a myocardial infarction in a first-degree relative and at the age less than 50 years. So let's move on to the lifestyle. He eats loads of fast food. He's not exercising anymore. His temperature is okay. His blood pressure is elevated. His BMI is high. So he's not fit. Examination shows a moist mucous membrane. This is rolling out diabetes, and he has normal jugular vein pressure. On auscultation, his lungs are clear, normal heart sounds, abdomen is healthy, it's soft, no hepatomegaly, no splenomegaly. His neural exam is also perfect. Let's see the question. Which of the following would provide the most important information in determining whether to start a lipid-lowering therapy? In order to solve this question, you need to know the indications for statin therapy and preventions of cardiovascular diseases. There are two types of preventions: the primary preventions for high-risk patients and secondary prevention for patients with past strokes or acute coronary syndrome. So we start statin therapy in primary prevention with patients with high LDL, more than 190 mg. Always start statin therapy with diabetic patients over 40. If your patient estimated 10-year risk of cardiovascular disease is higher than 7.5 to 10%, it's indicated to start statin therapy. For secondary prevention, you should start statin therapy for a patient who has had a myocardial infarction or stable angina or acute coronary syndrome or TIA in the brain or peripheral artery disease in the past. Also, patients with CABG are indicated for statin therapy. Note that ASCVD is the abbreviation for atherosclerotic cardiovascular disease. And in order to calculate the estimated 10 years of atherosclerosis cardiovascular disease, you need to use the cardiovascular risk calculator, or pooled cohort is an example of the calculator for the risk of the cardiovascular disease. Question: which one of these factors will indicate a lipid-lowering therapy using statins? A is the onset of the coronary artery disease in his father. This is not significant as his father develops this artery disease in older age. So A is false. B, an exercise tolerance by treadmill testing. This test is not normally indicated in asymptomatic patients, while it's indicated for patients with symptoms of stable angina. So B is false. Let's see if answer C is correct. A high sensitivity CRP. This is not specific to cardiovascular diseases, and it's not mentioned in the calculator. As well as D. D is not mentioned in the calculator. The apoprotein concentration. Some apoproteins like P100 is a lipid structural protein. So C and D are a big no. Let's see if F works out. Repeated LDL after lifestyle changes. It's not a typical indication for statin therapy unless the LDL is higher than 190. So E is the correct answer. It's the quantitative estimate of 10-year risk factor of the cardiovascular.